Good evening. My name is Joel. I'll be performing the head, ears, nose, eyes, and throat exam today. Physical exam as well as the respiratory and the cardiovascular exam. Hi, how are you doing?
Hello.
Oh, welcome. So first off, I'm gonna start with the hair or the head. Already inspected the hair. We'll be looking for any hair loss, any lesions in the scalp, any abnormalities, and I currently see none. So I'm just gonna feel for any lesions. Okay, it's symmetrical, skin is intact, no abnormal findings. Alright. Okay, as you can see, I didn't find anything abnormal, so I'm gonna move on to the eyes. So I'm gonna do a couple of tests to check for cranial nerve 3, 4, and 6. I'll do the cardinal field of gaze. So just follow my eye, follow my. Okay, so that was the test for extraocular eye movements. Also gonna do the Snelling test, which checks for cranial nerve 2, the optic nerve. Okay, just read these for me.
E, F, P, T, 0, C, L, P, E, D, P, E, C, F, D, E, D, F, C, 2, P, D, E, F, P, 0, T, E, C.
Perfect. That was good. So I have normal findings, and I'm gonna check for the peripheral vision. Second, sorry. Right. So let me know when you see my fingers. All right. Beautiful. So I didn't find anything abnormal with the eyes. The vision is good. I'm just gonna check for pupillary reflex or the corneal red reflex test. Good. I'm gonna take your glasses. Thank you. Right in this. Okay, pupils are equal and reactive to light. Now I'm gonna do the cover and uncover test. The eye should fixate toward my. Okay, let's cover one eye. Oh, sorry, eye cover. Okay. Beautiful. Okay. There were no visible abnormal findings with the eye, so I'm gonna now do the fundoscope exam. Right, so I'm just gonna look in the eye. I'm gonna be checking for any abnormalities. So the eye should be, the sclera should be clear, the conjunctiva should be pink. So let's just take a quick look here. We have no visible abnormal findings, which is good. Now I'll be following up, moving on to the ears. So for the ears, first of all, just gonna inspect for symmetry. See if there's any abnormal findings in the ears. No, all right. Just gonna check the lymph nodes in the ears. So do the preauricular. Checking the pinna and the tragus of the ears. Make sure it is. Alright. I'm gonna take a quick look in the ears before I do the whisper tests and the other tests for any problems with hearing. Okay. Tympanic membrane is gray and the light reflects off of it, which is good, normal finding. Okay. Just wax, nothing crazy. Alright, so now I'm gonna check, I'm gonna do some tests to check for any hearing loss. So the first test I'm gonna do is the whisper test. Just let me know if you hear what words I'm saying, okay? I'm gonna say 3 letters.
PCE.
Yes.
AFE.
Beautiful. So now I'm gonna conduct the Weber and the Rene test with the tuning fork. So first I'm gonna do the Rene test. It's gonna check for any sensory neural loss, sensory neural hearing loss. Okay. Let me know.
Yes.
On this side.
Yes.
All right. And the Weber test is also gonna check for hearing loss as well, but through bone conduction. So do you hear it on both sides?
Yes.
Say next time. Both sides or one side? Thank you. Alright. So the findings were normal. The sound traveled to both sides of the ears, which is good. Normal finding. Okay, change up my gloves. Sorry for that. Okay. Alright, so now we're gonna move on to the nose. I'm gonna be checking the nose for any abnormal findings. The nose normally should be, red, the turbinates, and the sinuses shouldn't be palpable. Should be palpable, but not too profound. Okay. Alright, take a quick look at the nose, pen light. An inspection, the nose is symmetrical. Skin is intact, no abnormal findings so far. Just gonna take a look with the scope. Okay, the nose is clear and nothing is abnormal. Everything is within normal limits. So now I'm gonna palpate the 3 sinuses in the nose area. So the ethmoid, which is the one on the outside. And I'm gonna palpate the frontal sinus, which is above the eyebrow, and finally the maxillary sinus, which is right on the chin. Just tell me if you feel any pain. Beautiful. Thank you. So there are no abnormal findings with the nose. So now we're gonna move on to the ears. Oh, I did the ears already. Sorry. I'm gonna move on to the mouth and the throat, and then up to the neck. So I'm gonna just take a quick look in the mouth, see if there's any abnormalities. So no abnormal findings. Everything is okay. The gums are pink, no gingivitis, no swelling, and the dentition is perfect. I'm gonna take. And now I'm just gonna check for the gag reflex. Okay, sorry. All right, gag reflex is present. All right, and now for the throat. Go. Drink some water. The water is good.
From where?
It's over
Okay.
here.
What? Can I figure out?
This is good. Okay, so I'm gonna palpate the thyroid. It shouldn't be profoundly palpable. I'm also going to palpate the cardic pulse, one side at a time. Beautiful. I'm going to quickly check the range of motion in the neck. Okay, so can you turn? Neck side to side, up, down. Okay, beautiful. Any pain? No pain, no pressures? All right, sweet. Change up the gloves. Okay. Now I'm gonna check. I'm gonna palpate the other lymph nodes present in the face. Okay. So this is the pre-auricular, post-auricular, occipital behind the neck. Mandibular and the submental. Beautiful. All right, so now we're gonna move on to the lungs and the thorax. We're gonna be listening for, well, we want to hear clear breath sounds in all the lobes. So moving on. So first of all, I just want you to take a deep breath. I'm going to check for chest expansion. Okay. All right. I'm also going to check for diaphragmatic expansion. Deep breath. Okay. All right. So check your capillary refill. Okay. Less than 3 seconds. Trachea. All right, beautiful. So now I'm gonna listen to the lungs. Should be hearing clear breath sounds all around. Deep breath. Deep breath. Another. Okay, so our clear breath sounds all across the lobes, and I'm gonna check for tactile firmness. Say 99.
99.
Again.
99.
Okay, tactile firmness. And then I'll move on to percussion. I'm just gonna percuss over the lungs. We don't want to hear any. The lung is hollow, so we should be hearing resonant sounds. No adventitious sounds were noted. Everything was clear and was resonant across all lobes of the lungs. Okay, so now we're just gonna move on to the heart. So first of all, just gonna check the precordium. The area is clear. No abnormal findings noted. I'm gonna palpate all the arteries, all the major ones. That we usually do. So I'm going to start with the brachial. popliteal. And then finally I'm gonna check the dorsalis pedis and the posterior tibialis, which are present in the feet. Okay. This is the and then behind posterior tibialis. Okay. And then you can lay back down. Okay, now I'm just gonna check for any jugular vein distension. Okay, just lift up like you're trying to do a crunch. Okay. Yeah. Okay. So no presence of jugular vein distension. So now I'm gonna palpate the PMI, and then I'm gonna move forward to auscultation. Okay. PMI is present. It's located in the fifth intercostal space, mid-clavicular line. So now I'm gonna listen to the heart sounds. We should not be hearing any murmurs. We should not be hearing anything aside from the regular heart sound, which is the S1 and S2. Okay. So first of all, I'm gonna listen to the aortic, which is in the right second intercostal space, mid-clavicular line. Pulmonic, in the left second intercostal space, mid-clavicular. Erb's point, third intercostal space, left sternum border. Tricuspid, fifth intercostal space, left sternum border. And the last one, the mitral, which is in the fifth intercostal space, mid-clavicular. Okay. All right, and that concludes our physical exam for the head, ears, nose, eyes, and throat, and the respiratory and cardiovascular systems. Thank you. And thank you very much for volunteering. Have a wonderful day. Bye-bye.